So today's planning is to fill up at the hairline, okay, and fill up at your temporals to give the density here. To fill up at your temples. It's not even. Your hair parting was here during your younger days, so you have more hair loss at this temple. Your right temple has more hair loss, your left temple has less hair loss. And then this is your hairline. We're gonna fill up, okay? Alright? This is your crown area that we're going to fill up. So the process of the planting of the grafts are going on. So you can look at it. We have not complete, but this is the hairline that we are doing. We have planted the hairline, created the frontal area, some in the temporal area. She has lost more hair in this part of the temporal area, and then also at the crown area. So planting is still going on. So you can see we are still doing the process of the planting. So while we actually basically close our patient's eyes, so we put a bandage like this because as we are doing the planting, we need to hydrate the grafts also to so that the planters, they can see the incision hole. So we always hydrate the grafts, and this hydration may irritate the eye of the patient, so therefore we always cover his eyes or her eyes.